start in about 2 minutes. Does that work for you? Yeah. Thank you. 2 minutes.
Good afternoon. My name is Stephen Mahan. I am the Grants Director for the City of Milwaukee, but also serve in the capacity of the Emergency Management Team for the City of Milwaukee, and was integral in some of the evacuation efforts with the community within a corridor. I just would like to start off as a precursor to this presser. I would like to reiterate comments made this weekend and the onset of this evacuation effort. The responsibility and the limit of scope for not only the City of Milwaukee and our friends at the State of Wisconsin, the Department of Health Services, and the Department of Natural Resources is to protect the health and safety of our residents. At this moment, we're speaking in particular to the residents of the community within a corridor. Our role was as first responders. The long-term relationship that the residents of this facility will be between the tenants and the tenant management company of the building. Again, we want to be able to, these individuals and families and, of our community to resume their lives promptly, but more importantly, safety, utmost safety. And that's what took place in the evacuation efforts. And we'd like to introduce now some of our friends at the state that are working with us diligently, and in particular, our DNR representative, Ms. Christine Seeger. Thank you.
Hi, everybody. My name is Christine Seeger. I'm the Director for the Remediation and Redevelopment Program for the Wisconsin DNR. So DNR is the regulatory authority that oversees investigation and remediation of the environmental contamination being conducted by community within the corridor. The property that they occupy at 32nd and Center has been used for industrial manufacturing from around the 1920s until the 1980s. The DNR works in partnership with the Department of Health Services and local health agencies when health risks due to chemicals that can cause indoor air concerns are present. DNR has been reviewing information regarding the environmental investigation conducted by community within the corridor since August 3rd, 2020, when CWC reported their intentions to renovate the existing building for a residential community. The contamination found at the property includes a solvent known as trichloroethylene, or TCE. TCE is commonly used for cleaning metal parts that have been manufactured and may also have been used in paint products. The presence of TCE was documented at the property prior to CWC taking ownership of the property. When TCE vapor is in indoor air, it can pose a health risk to occupants. TCE is in the soil beneath the building. Testing done by the consultant for community within the corridor found TCE in air below the building. This is known as subslab vapor. Because of the age of the building, its long industrial use, the complexity of its construction and foundation, and the levels of high TCE and soil vapor beneath the building, vapor intrusion has been a significant concern expressed by the DNR to CWC since early input. CWC's consultant proposed and constructed a sub-slab vapor mitigation system, which is a series of piping beneath the building floor connected to fans that are intended to remove contaminated sub-slab vapor to prevent it from moving into the building and affecting the building occupants. It's important to note that DNR became aware of test results from indoor air samples taken during the system testing by CWC in February at approximately 7 p.m. on Thursday, March 23rd. The levels were significantly above established health levels, and DNR passed the results to the Wisconsin Department of Health Services and Milwaukee Health Department immediately. It's also important to note that DNR was not aware that the building had been occupied for several months until after repeated requests made for this information since Monday, March 20th. The consultant confirmed occupants were in the building on the evening of March 22nd. The DNR has not had to work with this kind of situation previously, and that our recommendations are typically implemented by the party responsible for the contamination. And I will introduce now Dr. Curtis Hedman with the Department of Health Services.
Thank you, Christine. My role at Department of Health Services is to support our partners at Department of Natural Resources and our local and tribal health partners in matters that involve human health risk. In this case, I've been following the Community Within the Corridor project with the DNR for over 2 years now, and reviewing data as it comes in to make sure that it's below DNR's vapor action level, or VAL, which you might hear it called, of 2.1 microgram per cubic meter. The DNR VAL for TCE is based on EPA's regional screening levels and is also supported by the Agency for Toxic Substances and Disease Registry's minimal risk levels, or MRLs. When you're above the vapor action level, you're getting into an area of higher risk for associated human health effects. Some of those health effects include certain types of cancers. The EPA has classified TCE as a known human carcinogen, causing several types of cancer, notably kidney, liver, and some malignant myelomas. Also, and probably of more concern with acute exposure, is the developmental health effects TCE has been shown to have with women who are or may become pregnant. Those include fetal heart defect, immunological and neurological system changes, and lowered birth weight. When you're above vapor action level, the higher above that level that you go, the more the risk increases for associated human health effects. And we have to take that into account when we determine the amount of action that we're going to take to protect human health. When we have detections in indoor air above the VAL, we have what's called a completed exposure pathway. And as risk assessors, it's our job to take steps to interrupt that exposure as soon as possible. In the case of TCE, once you're away from the TCE exposure, the compound's going to metabolize and be removed from the body within about a day. So taking that step to interrupt the exposure is key in removing that elevated human health risk. Those are the basics, and I think I could turn it over to Steve now.
So we're going to open up at this time for questions. We have a panel of folks here. Hopefully we can answer everything, and what we can't get to you, we will get it to you at a later date.
Are the developers here?
I'm sorry?
Are any representatives from the development company here?
The development company was notified. We do have an event later today, but at this time they do not have someone that is representative.
So none of
No one from the development company came to the press conference.
I am looking about and I do not see anyone from, they are not up here, no.
Okay, thank you.
Were there not supposed to be residents in there, or did you guys know it was occupied? I know you mentioned that you did not know it was occupied, but were there not supposed to be people in there from the start, or can you clarify that a little bit more?
The DNR had strongly recommended in writing a number of times that the developers wait to have the building occupied until they could confirm that the vapor mitigation system was operating correctly, and that can take multiple rounds of testing once the system is running to know for sure that it's effective. So we had been very clear with them that our recommendation was that the building should not be occupied until we knew the system was effective.
So you were not aware that people had already been living in this building?
No, ma'am.
And you did not find that out until last week?
March 22nd.
Why were people allowed to live here if there were such high levels of TCE and you had given strong recommendations that no one occupy that building?
So the DNR doesn't have authority we don't issue occupancy permits. That's not authority that we have. We make sure that people are in compliance with the state's environmental contamination law, and we help them be in compliance with that. We provide technical assistance to them, but we're not the entity that issues an occupancy permit.
So who would be that entity out of everyone here? Who allowed people to live there?
Good afternoon, Erica Roberts with the Department of Neighborhood Services. So the department was asked to approve temporary occupancy certificates back in July of last year. At that time, the department was unaware of any of the ongoing investigation or levels of any potential hazards within the building. The building at that time was evaluated for compliance with the building and zoning and fire codes, which is the purview of the Department of Neighborhood Services. The building at that time was occupied in part based on the occupancy applications. In December of last year, those occupancies were extended briefly, which again is commonplace when any building is working towards a full occupancy of their facility. At that time as well, the department was unaware that any of these hazards existed.
When did
What type
you
of
be?
accountability is going to be held for those who own the property? Because this is serious for people who live there.
Correct, and right now there is no occupancy granted for the building, which is the purview of the Department of Neighborhood Services. In terms of further enforcement, I would defer to the DNR or other agencies that are interacting with the property at this time.
Which
But the
agency
D-
was responsible for telling DNS that this was actually going on, that there were investigations going on?
I'm sorry?
How did you find
Something
out?
fall through that there's a reason why DNS did not know about prior investigations?
I can't speak to the protocols that the DNR follows. Obviously, they've put a lot of time and effort into investigating this situation. We found out on Friday when the health commissioner found out as well.
So for DNR,
Was a full occupancy permit ever issued, or has it always been temporary?
It's only been temporary. There are applications in place for full occupancy, however, they've not been issued.
And would DNS ever, is there a hold for DNR on the DNS process, or how does that work?
There is not a hold, no. Those agencies traditionally do not overlap unless something is brought to our attention specifically in this case.
And who would bring it up to your attention?
I would imagine it would be our partners at the DNR.
can DNR explain why this land was allowed to be developed for residential use, knowing the high levels of TCE were there for years?
We often see that development occurs, redevelopment occurs concurrently with cleanup. It can be done safely. It happens. This is another spot where the DNR can't say to someone, you have to wait until you've completed all of the environmental cleanup before you can begin your redevelopment. They often happen at the same time. It can be done safely. And we don't have authority to tell them, nope, you have to wait.
Why did it take them a month from the results that came in February to tell you about the high levels in the vapor?
I don't know. I can't speak to that. You'd have to ask them.
Has the developer suggested at all at this point that there could be any kind of possible reentry depending on the floor of the building? Has the developer talked to you, either DNR, DNS perhaps, that reentry could be possible depending on the floor of the building?
They've had those discussions with us, but that is not something, we're not at that stage yet. Our focus right now has been on working with our partners in the City of Milwaukee, with Department of Health Services, and with the developers to make sure that the residents are taken care of. And we will find out in coming days. We'll be working on what the next steps are technically to hopefully make the building safe.
Are there any potential penalties for the developers or the manager there at the property for allowing residents to move in even though they were repeatedly warned that it wasn't safe?
I don't know. And again, our focus has been on the residents and making sure that these people who have been displaced from their home are taken care of. That's been first and foremost in our communications with them and our communications with you. So we'll be looking at the technical aspects as well as some of the other steps forward in the coming days.
Is there any way to check with residents, health checks right now to show early signs that they've been exposed or been affected by this? Or what is that like? How long does it take for this toxin to affect somebody?
I'll ask Curtis to comment on that.
Thanks, Christine. Yeah, speaking to that, with the levels that we're dealing with, it increases the risk of an associated health effect, but it doesn't confirm that that health effect is going to occur. So what we are encouraging and will encourage the residents to do is to talk these things over with their primary physician. And for those that are pregnant, certainly with their well baby checkups and their prenatal visits so that their physicians are aware of the situation and can follow them accordingly.
Were there any pregnant residents in the building?
We identified a handful that DHS has reached out to in a targeted outreach effort to make sure that they're connected appropriately with their physician to follow up.
So there were pregnant residents though?
Yes.
Can you tell us more about the type of ventilation system needed to be put in place for this to be a safe place for residents to live in?
Should I go back to Christine for that? Or Pam? Pam Milata from DNR. Can I speak to that? Thank you.
Hi, I'm Pam Milata. I'm one of the supervisors in the remediation and redevelopment program and have been working with our project manager and with Christine on this project for several months. I can tell you that it is the responsibility of the consultant, environmental consultant, who is designing a system like a vapor mitigation system to demonstrate that the system is functioning so that it will be protective. So each building, each situation requires a different kind of operation, and it really depends on the consultant to run testing to demonstrate that, number one, the system affects the entire building, and number two, that there are not indoor air exceedances or high levels of any contaminant that's not supposed to be entering the building from the subsurface. So those tests have to be run. That's the only way to really, there are design things, and I'm not an engineer, so I'm sure there are design ideas that other engineers have and that they start with, but in the end, we expect that they would be testing those features to demonstrate that they work.
You mentioned requirements for these systems, but then you also said that DNR strongly suggested nobody move in until these mitigation systems could be complete.
That's
It
correct.
just, it seems to be almost condescending. Requirements for strongly suggested. I mean, at some point, there was a failure of accountability here.
I think that it is not our authority to require or prevent a developer or anyone from occupying or building a building while they're undertaking remediation. So we don't have that authority, which is why we make strong recommendations as to how they should proceed. But in the end, it is really the responsibility of the developer, of the property owner, to ensure that the occupants of their buildings are safe. So
So there's no one that can check the developer to make sure that things are safe.
I don't want to say that, I'm not sure. I
Because
would
in this
think
case,
that,
it seems like there was no one that did that.
I would say that as part of the remediation process, the developer, the owner of the property, is required to provide the DNR with updates and reports that document their actions and document that they're making progress and demonstrating that the remedial measures that they're putting in place are working. So in as much as they provide that information, the DNR can review it and determine whether they've made the right demonstrations, the right tests, and demonstrated that their systems or their remedial actions are working. So they are required to give us that information.
But if you don't like the information,
Then we would respond back, and we've been very responsive to this developer and their consultant all along the way, reviewing all of their reports, providing comments and recommendations and concerns about what they've given us. So that's our job, and I think we've tried to do it for just about everything they've given us, we've looked at.
Thank you guys. We have to get them to the residential meeting, which is closed to media, but I appreciate you guys all covering this. Thank you. The residential meeting is closed to media.